I stopped correcting the discharge summaries 3 weeks before Dr. Brennan fired me. That's the thing about hospital administration. Everyone thinks it's paperwork and scheduling. They don't realize it's pattern recognition. It's knowing that when cardiology bills a consult on the same patient twice in 48 hours, someone's padding numbers. It's understanding that the new electronic health record system we spent $14 million implementing has a fatal flaw in its trauma intake protocol that could cost us our Level 1 certification. I was the director of clinical operations at Mercy Regional. 11 years. I'd built the bridge between the doctors who save lives and the administrators who counted money. I spoke both languages fluently. Dr. Brennan spoke neither. She arrived in August with a doctorate in healthcare management from a program I'd never heard of and a last name that matched the hospital board chair. His niece, 29 years old. Her office had been renovated before she started glass walls, minimalist furniture, a motivational poster about disruption. I knew we were in trouble when she called her first meeting. I've been reviewing our operational efficiency metrics, she announced, standing at the head of the conference table in a cream pantsuit that probably cost more than my monthly salary. And frankly, I'm concerned about redundancy in our administrative workflows. The room was silent. Department heads exchanged glances. Redundancy, I repeated carefully. Yes. She clicked to a slide. It was a flowchart that made no sense. We're double-checking work that doesn't need double-checking. It's slowing us down. My MBA thesis was on lean healthcare operations. We need to cut the fat. I looked at the chart. She'd identified my department clinical ops as the primary bottleneck. Dr. Brennan, I said, keeping my voice level. The double checks you're referring to are quality control. We verify physician orders against insurance authorizations, cross-reference medication interactions, and audit billing codes to prevent fraud flags. Exactly, she said, as if I'd just proven her point. Bureaucracy. We have software for that now. The software makes mistakes. Then we fix the software. She smiled. It was the smile of someone who'd never watched a patient die because someone clicked the wrong box. This isn't personal. It's optimization. Over the next 2 weeks, she sat in on my department's operations. She watched us work with the intensity of someone looking for evidence of a crime. She found it in the coffee. I had a small Keurig in my office. I bought it myself 5 years ago because I worked through lunch most days. People would stop by nurses between shifts, residents with questions, even attending physicians who needed something fixed quietly. Dr. Brennan stood in my doorway on a Tuesday morning, her assistant hovering behind her with a tablet. Is that a personal appliance? She asked. I looked up from the medication reconciliation report I was reviewing. Yes, the coffee maker. I brought it from home. Hospital policy states that personal appliances must be approved by facilities management due to electrical load concerns. I set down my pen. It's been here for 5 years. That doesn't make it compliant. She stepped into my office, her assistant following like a shadow. And is that a space heater? It was. A small one under my desk. The HVAC system in this wing had been broken since March, and facilities kept saying they'd fix it. Yes. Also non-compliant. She made a note on her tablet. I'm going to need you to remove both items by end of day. Dr. Brennan, with respect, there are bigger operational concerns we should. Are you refusing to follow hospital policy? The question hung in the air like smoke. I could see the trap. I could see exactly where this was going. No, I said quietly. I'll remove them. Good. She turned to leave, then paused. Oh, and I'll need the cardiology billing audit you've been working on. I want to review it before it goes to the board. That audit, the one that showed Dr. Brennan's uncle's hospital was losing $300,000 a year to improperly coded consults. The one that would require retraining and oversight. It's not finished, I said. Then finish it. I want to by Friday. She left. I stared at the space heater under my desk. Then I looked at the audit file on my screen. I'd spent 6 weeks building that case, cross-referencing billing records with patient charts, documenting the pattern. I saved my work. Then I closed the file. I didn't touch the audit again. Friday came. Dr. Brennan called me to her office. Where's the cardiology report? She asked. She was standing behind her desk, backlit by the window. It was very dramatic. I haven't completed it yet. I gave you a deadline. I had other priorities. The trauma intake protocol has critical gaps that need. The trauma protocol is fine. We've been using it for 3 months without incident. We've been using it for 3 months without a mass casualty event, I corrected. If we get a bus accident, a shooting, anything that brings in more than 8 critical patients at once, the system will cascade fail. We won't be able to track patients through triage. People will die in the waiting room. Dr. Brennan's jaw tightened. You're being dramatic. I'm being accurate. You're being insubordinate. She sat down, folding her hands on her desk. I've been patient with you. I understand change is difficult, especially for someone who's been here as long as you have. But this attitude, this resistance to new leadership, it's toxic. I said nothing. I'm placing you on administrative leave, she continued. Effective immediately. 2 weeks. Pending a review of your performance and cultural fit with the organization's new direction. Administrative leave. The corporate purgatory before termination. I see, I said. You'll be paid, of course, but I need you to clear your desk and surrender your badge. HR will be in touch. I stood up. Can I ask what specific performance issues you're documenting? Failure to meet deadlines. Resistance to leadership directives. Unauthorized personal items in the workspace. She tilted her head. Should I continue? No, I said. That's clear. I walked back to my office. My hands were steady. Inside, I felt something cold and clarifying settle over me. I packed my personal items slowly. The photo of my mother. The coffee mug my team had given me last Christmas. I left the Keurig. Let them fight over it. Then I sat down at my computer. I didn't delete anything. I didn't sabotage anything. I simply logged into the shared drive and changed the permissions on my working files to view only for everyone except myself. The cardiology audit. The trauma protocol revision notes. The Medicare compliance documentation. The contact list for every department head's personal cell phone, built over a decade of after-hours emergencies. All of it locked. I logged out. I wiped my browser history out of habit. Then I stood up, picked up my box, and walked past Dr. Brennan's glass office without looking in. Security escorted me to the parking lot. The guard, Miguel, looked miserable. I'm sorry, he muttered. It's fine, I said. Just doing your job. I drove home in silence. I didn't cry. I didn't scream. I went to my apartment, poured a glass of wine, and turned off my phone. I didn't turn it back on for 36 hours. When I finally powered up my phone Saturday evening, it vibrated for 90 seconds straight. 23 missed calls, 41 text messages, 67 emails. I scrolled through the messages with clinical detachment. Friday, 3:47 p.m. Jennifer, trauma RN. Where are the protocol revision notes? Dr. B is asking for them. She's freaking out. Friday, 6:15 p.m. Michael, billing director. Did you lock the cardiology files? I can't access them. Brennan is demanding the audit for Monday's board meeting. Saturday, 9:23 a.m. Dr. Patel, chief of surgery. We had a 4-car pileup come in last night. 7 critical patients. The intake system crashed exactly like you said it would. We had to use paper charts. It was chaos. Where are you? Saturday, 2:14 p.m. Unknown number. This is Ellen Reyes, the hospital CEO. Please call me immediately regarding your employment status. This is urgent. I set the phone down. I poured another glass of wine. They didn't need me, I reminded myself. Dr. Brennan had said so. The system was optimized. They'd cut the fat. I spent Sunday at a botanical garden. I walked through the orchid greenhouse and marveled at how quiet my mind felt without the constant background hum of hospital crisis management. Monday morning, I woke up at 5 a.m. anyway. Habit. I made coffee. Real coffee, from beans, not a Keurig. I sat by the window and watched the sunrise. My phone rang at 6:47 a.m. CEO Ellen Reyes. I let it go to voicemail. She called again at 7:02, at 7:15, and Fina, why at 7:33? At 8 a.m., there was a knock on my door. I looked through the peephole. A man in a suit stood there, holding a briefcase. He looked nervous. I opened the door. Ms. Whitmore, he asked. Yes. My name is David Chun. I'm the hospital's general counsel. May I come in? I considered. Are you here in an official capacity? I'm here to beg, he said. I let him in. He sat on my couch, briefcase on his lap, and didn't waste time. The board meeting is this afternoon. The auditors are asking about the cardiology billing irregularities. Dr. Brennan can't access your files. She says you locked them. I adjusted permissions to reflect my termination, I said calmly. Those were working files. I assumed someone else would take over the projects. No one else knows how to access your project documentation. The file structure is complex. It's organized chronologically by department with cross-references to incident reports and compliance flags, I said. It's very straightforward. David closed his eyes. To you, Dr. Brennan has an MBA in healthcare management. She has a degree and her uncle's last name. He opened his eyes. Please, name your terms. Full reinstatement. Title change. Salary increase. Whatever you want. I looked at him. David was a good lawyer. He'd backed me up countless times when department heads tried to bypass protocol. I don't think Dr. Brennan would appreciate me returning, I said. Dr. Brennan is currently in the CEO's office being asked to explain why she placed our director of clinical operations on leave without board approval 3 weeks before a compliance audit. That sounds stressful for her. The board is voting this afternoon on whether to terminate her appointment during the probationary period. He leaned forward. But even if they fire her, we still need you. The trauma protocol failed. We almost lost our certification over the weekend. The state inspector is coming Thursday. I sipped my coffee. That is very soon. Please. I set down my mug. I don't want my old job back, David. His face fell. I want a different one. He blinked. What? Chief Operating Officer. Full operational authority over all clinical departments. Budget control. The ability to hire and fire without executive approval. And I want Dr. Brennan's firing to be public and attributed to her inability to understand hospital operations. David stared at me. That's a massive promotion. Yes, the board would have to approve. Then I suggest you call an emergency session. I stood up. You have until noon. After that, I'm accepting an offer from Riverside Medical. They've been headhunting me for 2 years. That was a lie, but David didn't know that. He stood up, fumbling with his briefcase. I'll call the board chair now. Good luck, David. He practically ran out the door. I waited. At 11:47 a.m., my phone rang. CEO Reyes. I answered. Chief Operating Officer, she said without preamble. 20% salary increase. Full operational authority. 3-year contract. You start immediately. And Dr. Brennan? Terminated. Effective immediately. The board statement will cite fundamental misalignment with organizational priorities and premature operational changes without adequate review. I closed my eyes. I'll need that in writing. I'm emailing the contract now. I hung up. 30 seconds later, the email arrived. I read every word. Then I signed it electronically and sent it back. I returned to Mercy Regional on Tuesday morning at 6 a.m. The badge reader beeped green when I scanned in. My new title was already in the system, COO. I walked past Dr. Brennan's old office. It was empty. The glass walls were bare. The motivational poster was gone. I went to my old office. Someone had left my Keurig on the desk with a note, "Welcome back." To the team. I plugged it in. Made coffee. At 7 a.m., department heads started arriving for the emergency operations meeting I'd called. Dr. Patel saw me through the conference room window and smiled, relief washing over his face. Jennifer from trauma hugged me. Michael from billing actually teared up. Okay, I said, sitting down at the head of the table. Let's talk about the trauma protocol. We have 48 hours to fix it before the state inspector arrives. Here's what we're going to do. I opened my laptop. All my files were there, unlocked, waiting. We worked for 16 hours straight. By Wednesday morning, the new protocol was implemented, tested, and documented. The state inspector arrived Thursday at 9 a.m. She left at 4 p.m. with a full compliance approval. That night, I stayed late in my new office, the COO suite on the executive floor. It had windows overlooking the city. No broken HVAC. I made myself coffee in my Keurig and stood by the window. My phone buzzed. A text from an unknown number. I heard you got promoted. Congratulations. You destroyed my career. I hope you're happy. Dr. Brennan. I stared at the message for a long moment. Then I deleted it without responding. I wasn't happy. I wasn't vindictive. I was just tired. And I was exactly where I needed to be. The coffee was still hot when I sat down to review the cardiology audit one more time. There was work to do. There was always work to do. But now, at least, someone was listening.